Hello.
Good.
How are you today?
Good.
So lots of fun stuff will happen today, okay? I'm gonna try to clean up your teeth a little bit and then we're gonna take a full scan. And we're gonna lay you back. You let me know if you have any discomfort, okay?
Okay.
Have you open up big for me? Your oral health is linked to so many things, risk of stroke, heart disease, Alzheimer's, all of these things. It's so important. The thing that worries me is having active disease in your mouth, and especially with your medical history, it's not good for your overall health. It puts you at risk for other issues.
Right. At my age, I might have them all out.
Yeah, and again, I don't want you to feel pressured into anything. A lot of the folks we serve, they're really up against it. They really haven't been dealt the cards. And they're at the mercy of a medical system that is trying their best to care for people, but doesn't always efficiently care for people. It doesn't work and it needs to be fixed. So I built the best thing I could build with the budget I had in the best way I could.
Thank you, ma'am.
No problem. Be very careful and watch your head going out in the railing, okay? It's a dental clinic on wheels. We're able to bring a full dental experience to someone that lives in the ruralest places of Maine.
There's a significant disparity in oral health in the state of Maine, and I think really across the country. The traditional model of care has been working very well for some, but it has completely blocked other people. It needs a revolution.
I knew going into this that this was going to be a labor of love and it was going to be something that I devoted the rest of my life to. This is just a small step to try to help fix that system.
We're in here.
Whoa!
This is so.
Is that toys?
Yes, but we're gonna stay away from the toys and go right to the chair.
Oh my goodness, hello.
She is so excited about life.
How are you? You can come
This
sit
is
right
Kyla.
here.
Whoa, what are these?
So I'm going to show you my silly flashlight on my head first. Look, watch this.
A flash.
That helps me look at your teeth. Wowzers, whoa, look at those beautiful teeth in that mouth. All right. It was a really long journey to get here.
Hello? What is this?
I come from a family with a dental background, and I grew up always knowing that I wanted to live a life of service. You're safe with us, okay? I'm gonna lay this chair back though, so you wanna hold my hand?
Whoa!
There you go. There you go. All right. This is my tooth mirror, okay? Open big for me. I struggled in school when I was younger, and I didn't always see my worth and what I could give back to this world, but I always knew in my heart that what I was good at was loving people. I've just always deeply felt for people since I was a child. I had gone to Haiti with my dad, and I did dentistry with him as well. I knew that's what I wanted to do, but I didn't think I could get through school or do it. I never thought that that would end up being a career path, but I'm so passionate about this. I could talk about teeth forever if you asked me to. All right, we're gonna do some videos of your teeth. Look at you right here on my computer. And smile again, say cheese.
Cheese.
When I met Amber, I realized she had a lot of passion. She wanted to help people. You know, that was her primary focus in life, was to help people. And that's something I always wanted to do as well.
And go, ah. Even more, say ah again. Keep singing for me. Good job.
Like a little mermaid.
You're awesome. Mainely Teeth was really born out of my desire to try to meet people where they're at. We do not turn anyone away. We're here to fill the gaps between the underserved and underinsured populations. You did it. I'm so proud of you. Good job.
You did great. Let's go push the buttons on the elevator, baby girl. You did great. Over here. Over here. Let me see how sparkly. Holy smokes. I need the sunglasses.
Grabbing extra toothbrushes.
We have enough kits. Are these clean?
Those are clean. I have 5 X-ray kits, 2 Cavitron tips, and And I got 4 regular full kits there.
I'm gonna grab myself some.
On our very first date, probably the first thing we talked about, other than Amber's love for horses, she wanted, at the time, she called it a dental bus.
I think for the last 13 years, I wanted to build this mobile dental clinic. I really envisioned creating a space everyone could go into.
The polisher? Yeah, we have one of those on there too. This stays on there. That and the mouthwash trimmer stay there. Anything else?
Nope. My loops, yep.
Your loops?
That's important.
Those are important too.
Very important.
Skip forward a couple of years. She had been doing public health work for a while.
I would go into schools and do oral health screenings and varnish. And then COVID hit. All of a sudden, I couldn't go into schools anymore. So my job just went, but really, I didn't even care about my job. I cared about all those kids that I was seeing, because all the kids I was seeing weren't being seen by anyone else. I couldn't sleep at night. All right, let's load it.
She shook me awake one morning and said, "It's the time, we're gonna do it."
And he was like, "Really, are you sure?" And I was like, "Yeah, we gotta go all in now. This is a crisis."
She said, "Yes, we have an appointment this weekend to go talk to some folks about building our mobile unit." And I said, "Okay." We built the clinic in 2 months, I think. It was mind-blowing. I started getting permissions to park in parking lots, and that's how Mainely Teeth came to be.
Careful, you're real close over here.
I know.
We put everything we had into it. All our money, all our time.
Oh my gosh, that is close. Wowzers, I just held my breath. Holy macaroni. Okay, check the lights.
So other than the extra tooth, are you having any like pain, discomfort, anything like that going on? No? Good. Do you remember the last time you went to see a dentist? No, I don't. Okay, not a problem. Hearing that a lot too.
Maine is a state where people really care about each other, and there's a deep sense of community, but Maine is also a state that lacks a lot of resources. We have a small population, and when people are spread across a large geography, it's hard because it's not necessarily cost effective to have every service in every small town.
So Brian, your teeth are feeling okay today? You said you have an extra canine in there, and that was on the bottom? Oh my goodness, okay. I'll take a look. Was that a baby tooth that maybe never wanted to fall out?
Oral health is really an essential component of overall health. Our dental care system was never designed from the beginning with the idea of serving all people with a healthcare need.
And bite together.
Too often, it has been thought of as, a luxury that only some people can afford. And I don't think that's unique to Maine. I don't actually know of any state in the nation that feels like it has sufficient dental care capacity.
And we are gonna go around and just take a bunch of pictures of your teeth.
MaineCare is the Medicaid of our state, and the folks that have MaineCare are the most at-risk populations that need it the most.
There's that baby tooth. Hanging on for dear life there. There we go. And then bite together and smile for me. Nice smile. Awesome.
In our community, especially in Knox County, which has about 25,000 in it, we don't have any dentists that accept MaineCare for insurance. 7,500 people live in Rockland. It's a beautiful area. It looks like a very affluent community. However, poverty is very high. We have a lot of families who struggle.
And the chair's just gonna go back a little bit there. Are you from Maine?
Yeah, I am. I'm from Rockland.
From Rockland, like born and raised? Okay, cool. And I'll have you open nice and wide.
If a student has cavities, if they have a lot of mouth pain, they're just not going to be able to learn the way they should be learning.
And you are all set.
Thanks for coming to visit. Parents are driving hours to get their kids to a dental appointment. A lot of these kids are going without that care. They need help like yesterday. So Sean, we're a little different in the sense of we use these photos and x-rays to do a virtual exam. So we don't have like an actual dentist present here with us, but what they do is they'll check through all these photos and basically do the exam over the computer, which is kind of cool. I grew up in very rural Vermont, very limited access to healthcare, dental care, and I saw how that affected my teeth, my parents' teeth, my sister. I see children come in my chair and I look at them and I'm like, I was you, all the way back. We can break this cycle because I broke my cycle and I believe in these kids. There is a little spot down here that I'm a little bit more concerned about, so I think what we'll do is send you with a referral to a local dentist. They'll be able to take a look at that spot and just see if it needs any further treatment, okay? There's so many people who need our help, and what really inspires me about Amber is she's willing to go above and beyond and reach all of those populations. You're good to go back to class. Bye, Sean.
I started out primarily focusing on pediatrics. That was kind of my thing.
And down we go!
All right, let's see here.
What started happening was families were coming in, the parents were bringing these kids and they were like, can you help me? Can you look at my mouth? How do you say no to someone when they ask for help? I couldn't turn them away, and just organically, it kind of took shape and we'd see everybody.
Awesome, yay, you did it.
As we started to grow, we ended up getting the root cellar clinic.
Portland's Maine's largest city and a population of about 60,000 people. The whole idea of the root cellar is a group of Christians that are responding to the needs that they're seeing in impoverished communities. One of our founding members started a dental clinic. We met up with Amber, heard her story, heard her heart, and it was just really clear. She's not just interested in teeth or interested in oral health. These aren't just interests, these are callings. Our clinic was sitting empty for the most part. She was in need of extra space. She's told me she had about 900 people on a wait list, which is just kind of mind-boggling. She said if we had a couple more chairs at a central location, we could work that list down. And I said, well, we have space and we have chairs. So Mainely Teeth has been serving out of this location since June of 21.
Oh. Hello, Mainely Teeth Portland office. How can I help you?
Thank you for coming in today and helping. I really, really appreciate it. Your first one, we're gonna put you in here for right now, the first one. Okay. We're gonna have a Swahili interpreter.
One of the biggest needs in the city of Portland and in Maine in general right now is showing up within the asylum seeker community. It's growing literally daily.
I have a kit for a little one, kids kit.
A huge challenge is that they can't work until they receive their work papers. That can take sometimes up to 2 years. These families, unfortunately, are in a situation where they're kind of in a holding state. There are a lot of needs surrounding them, and one of them is healthcare.
Has he been seen by a dentist in the past?
Four years ago.
Okay.
3 years ago.
Okay. And did they do anything more than a cleaning? No, just cleaning. Okay.
Here you go.
Glasses.
They come from all different backgrounds, all different countries, all over the world, and they have a lot of challenges. We try to make it easier for them to get the care that they so desperately deserve. We're trying to really care for the whole person, so we ask that they're warm, that they're fed, and that they feel safe.
I won't hurt you. I'm gonna bring you up. Is that okay? Okay, we're going up. I'm from Rwanda. When I came to America in 2015, I spoke English, but it was very little. And like, when you come to a country as a foreigner, the only thing that you have to back you out is yourself. I'm gonna count your teeth. Say and then good job. Good job. I came as a student, and then I studied, and then after that, I had to seek asylum. When I decided to come to Maine, I met more immigrants. Everybody has a story that's different, and everybody deserves to be heard. You did it too!
Hey, look. Hey, look.
Oh, Dad.
Look it. Do you want to go get a toy?
Toy.
Yes, let's do this.
Toy.
I got married really young to a really great person. We decided to part ways, but we have 2 amazing children together. When I moved with the kids, I was on my own with them and I didn't have much, and I didn't have a support system up here, and I had no money, and I was on Maine Care. I have a daughter that is on the spectrum. She's autistic, and she was born really early, so she had a lot of medical issues when she was younger. I had to learn how to navigate the system on my own, and it was really hard, and I sometimes had to choose between going to work and staying in the hospital with my child. I even lost a job here because of it, because she was sick and I was alone. We were lucky enough to qualify for Medicaid and get food stamps and all of those things, and we had people give us, you know, winter jackets, and that's the community I'm serving now. And I was better off than probably most of the people I'm serving at that time even, but I got a taste of it, and I'll never forget it.
So he has some cavities on his bottom molars. So we're gonna get him in because he has a hard time sitting, which is okay, and that's okay. He did nothing wrong. He's a wonderful child. It's nothing that you did wrong. I just want you to know that, okay?
Okay. It was a struggle in the beginning. She was paying out of her own pocket to treat patients for a year. Things really started to take off once people saw the effect that we were having on the community and when they knew they had a place to go. You can have a seat, make yourself comfortable. We're gonna clean your teeth like normal and then we'll get you going, all right?
I grew up in the woods around here. City life, no, sir, not for me. No. I got to do some more building and little house for my daughter. All in time. All in time. My grandfather was a fisherman, and of course I went on the water when I was just yay high to a grasshopper. Went through the Coast Guard, 71 to 75. That's the ship that I was on, WAC 32, 327-footer. I spent 2 years on that thing, all up and down the East Coast, pretty much. I was up in the Arctic Circle 4 times, down beyond the islands, and anywhere in between. I've seen my share of events. Oh. My last year in the Coast Guard was West Quarter Head Lightkeeper. You're out there all alone. You got to keep that light going. I was one of the last light keepers before they automated the place. I don't have a job anymore. But I look back at it and I'm proud of doing that now, you know, serving my country, you know. Growing up, my teeth wasn't very good shape. I believe it was early 1972 when I got these, and I got them through the VA. I had all my uppers, what I had left of them, pulled at the same time, and then these dentures installed. And I gotta say, by God, they've held up good. What's left of them? Practically all gum now, and probably so thin you could see through them. It's going to be good to have something new.
Hello.
Hello, good morning.
How have you been since I last saw you?
Great, great.
Hanging in there?
Hanging in there, right.
Good.
Yeah.
Good. We're gonna get, so we have this new fandangled machine. We're gonna scan your mouth with it.
Oh, great.
Yeah. Really exciting.
I guess.
Oral health in the state has been a real struggle for some time, so a lot of the folks that need us have experienced gaps in care. That's generational. You're the most committed person to their dentures I've ever met.
Oh, man. I wouldn't leave home without them.
You wouldn't leave home without them, yeah. As you can imagine, some of these cases we see are really complicated, and that can involve specialists and things like that, which there's also a shortage of. Mobile dentistry, it has been around. I'm not the first person to do this, but new oral health cameras and having teledentistry now available, that brings a lot more care to people.
Unless a veteran fits a very specific criteria with the VA, they don't qualify for dental care.
Oh, that's good. I think you got it all.
Only 10 to 15% of veterans receive their dental care from the VA. So all those other veterans are either connected by their work or their spouse's work to dental care, are paying out of pocket, or just flat out cannot afford it.
I'm so thankful you came to see me today. I will give you your dentures back, I promise.
Oh, come on.
I don't want me to be the one that, after all these years, I'm the one that makes you lose them. I don't want to be that person, but I do want to be the person that gives you more teeth, though.
Yeah.
So let's do that. If I can help them feel cared for, and even if they haven't felt that way for a really long time, sign me up. So I did, I signed up.
Yes.
Watch your head, the clinic wasn't built for tall people.
Oh. Well, it's going to seem strange to see teeth. Well, I smile right now. It's mostly lips. I'm probably going to go out there and act like a fool, you know, smiling at everything. I have a disabled daughter. I take about everything I have and I put it her way. I help take care of her, and wouldn't have it any other way. Yeah, that'd be one of the first places I'll be going, right down there to give her a big smile. Dad? Yeah.
Come brush your teeth. You brush your teeth? Come on, let's go. We have 5 minutes. I think I've always had a public health spirit and soul. I just didn't know that it was called public health until I sat in Courtney's class. And it finally had a name.
I met Amber at the University of New England when she was a student in my community health class. And the very first day of class, we typically spend some time talking about how, through our profession as a dental hygienist, we can serve communities and populations. I could tell that Amber was really into this material.
Can you come talk to me for a minute? What's your schedule today?
I just have school, a soccer game after.
If there's a need that Amber knows about, you can guarantee that she's doing something to help that person. She's a problem solver. She's a solution finder.
It all just made sense and it clicked, and I was like, this is it. Like, this is what I'm supposed to do.
When I left, she was actually waiting for me outside the building. And she said to me, "This is why I'm here. I've waited my whole life for this, and this is what I'm meant to do."
How are you? I haven't seen you. It's been like months.
I don't know that I knew on that day what she would do with her career, but I certainly knew in that moment that she was destined for amazing things.
That's how I feel about today. She was the first person that looked at me and told me that I was gonna be great. That was like really big for me. And I don't need to be great in what I do, so I don't want that misunderstood. But she told me I could, and I never had anyone do that before.
Okay, you ready? Lay back on me, buddy, okay?
I was able to develop a skill set that I thrived in, that I latched onto, that I'm passionate about, and help people. So I promised myself if I ever got through school that I would dedicate my life to public health.
Oh, your tissues look so much better. I'm so proud of you.
Our family time is spent with animals. It helps me escape from the weight that I feel, that I carry sometimes at work. I put every ounce of myself into it every day. Wow, we have everybody's attention. Look at all of them. I feel popular. In order for me to make change and to dismantle the system, I had to figure out what the system was. It was my job to go out and discover the landscape of Maine. I think I volunteered 10 different places across the state in different capacities. I had the worst jobs, I had the best jobs. I made terrible money. I had a lot of setbacks, but it directed me and it had its purpose.
There are many mobile dental providers, but the thing that's really unique about Mainely Teeth is that they're not just a dental hygiene service. They are shattering glass ceilings, they are breaking down barriers, and they are providing an innovative approach to truly holistic oral health care.
Hello.
How are you today?
Doing fine, thank you. Doing fine.
So these are your dentures.
Oh,
okay,
wow.
we finally get to actually do the
Yeah, nice
delivery
smile.
for you today. All right, so we'll get these tried in. Now bite together.
Mainely Teeth is doing a really good thing for us veterans. Teeth.
Yeah. And they've got pretty good suction. All right. Okay, Amber.
I'm excited to see. Can you smile for me? You're so handsome. How do you feel?
I feel good.
Is it weird? It's gonna feel
It's
weird.
weird.
It's gonna feel weird. It's like the start of a new chapter, right?
A whole new life. Couldn't thank him enough. I'll thank him even more, by God, when I'm gnawing on something good with them new teeth.
But don't lose those.
I think she's gonna think it's pretty cool. Hey, honey.
Oh my god.
Imagine it, huh?
It's crazy seeing you with an actual smile.
Backwards.
They look good though.
Thank you, baby.
They honestly look really good compared to the ones you had in the past, which were...
Come on. Them things got me through decades. Just enjoy life, be happy. Well, let me see. These gonna work or not? Get some good teeth and smile. That'd be great for everybody.
It's a blessing to be able to work with somebody you love and enjoy being around all the time.
It's gonna be a good weekend.
It's very easy to follow somebody that you trust, that they're doing the right thing, they're doing it for the right reasons, and they're not gonna stop.
It's an odd feeling from being someone that got lost in the shuffle to someone who now is running something like this. Like, I didn't ever think in a million years that I would be that.
We went from nothing to let's build a trailer, and 2 weeks later we had a plan and a contract, and 2 months later we had a functional mobile unit.
To be fair, it had been in my brain for quite some time.
It had been in your brain, but taking that first step.
Yeah, I know, it is kind of crazy. You're right, maybe it's good that I'm crazy.
Not crazy. Motivated.
I'm right here with you, buddy.
I thought that I was gonna go do street dentistry by myself in a trailer for a year and see what happened.
Wow!
We're now in 80-something places treating people. We have thousands of people waiting to see us. We have people asking to copy the models that we're doing. I'm really proud of you. And I'm sitting here going, wait a minute. I'm still not even there yet. It's all supposed to happen this way, though. I'm sure of it. And change is coming, I can feel it. Sometimes it feels impossible, but I'm not gonna give up.
may be looking, but I'm not looking to settle down. I wanna go a little further out.
Our first official offertory in the WIC. We're really excited we get to see a bunch of kids here. Mom, dads, and babies.
Welcome to our new office. We just got the keys. This is going to be our surgical suite right in here. This is going to be our sensory-friendly space with a chairlift. What are you thinking, Mr.
Plenty of space.
Plenty of space.
I wanna go